A warm welcome from Zurich, Switzerland.
And also from Jena, Germany.
I'm a speech pathologist and would like to reflect, together with ENT surgeon Dr. Volk, on the physiology of the facial muscles and its impact on therapy. While the big motor units in the leg are designed for strength, the small motor units in the face allow us to make precise facial expressions. Proprioception is important to steer muscle movements. However, there are no sensory fibers in the facial nerve that help us calibrate the two sides of the face. There are no muscle spindles in the face like in the limb muscles. Therefore, some researchers think that receptors in the skin and fibers of the trigeminal nerve operate as sensory feedback. But recent work has discovered structures in the facial muscles that resemble Ruffini corpuscles as a source of proprioception. The degree of denervation or reinnervation determines the muscle activity and thus also the optimal interventions in therapy.
Seeing a patient with no facial movements, a needle EMG can be very useful to choose the optimal therapeutic options, but also to give a prognosis about the chance and the time course of recovery. Here, a needle EMG of the orbicularis oculi muscle is shown. Additional sensibility and proprioception of the face should be tested in a physical examination. On this slide, 3 different EMG recordings are shown. While the first recording shows no EMG activity at all, the second picture shows pathologic spontaneous activity. This is a hard indicator for denervation for more than 10 days. So at least some axons have been destroyed and rehabilitation will take several months. Some misdirected reinnervation will occur. In contrast to these very negative findings in the middle, the last recording on the right side looks similar, but it has much better prognosis. It shows typical motor unit action potentials. So at least some axons have survived. So the chance of recovery are much better. By inserting a needle EMG and triggering so-called insertion activity, the presence of muscle fibers can be proven without ultrasound or MRI imaging. The degeneration atrophy of the muscle is important when planning the therapy, but also for choosing the optimal surgical reinnervation techniques.
As long as there are no connections between facial nerve and muscle fibers, active movements have a frustrating effect on the patient and in most cases increase the asymmetry in movement and at rest. Many patients tend to compensate the flaccidity of one side with hyperactivity of the other side. That is why regular relaxation of the healthy side is important. Due to the lack of muscle movement, changes in the soft tissue are to be expected. Therefore, the patient should be instructed in manual techniques. In the video, you can see a few massage and stretching techniques.
With no muscle movements, even with intact afferent nerve fibers, the loop is broken. By tactile stimulation of the skin, sensory input into the loop can perhaps slow down this process. At the same time, a manual massage maintains the flexibility of the tissue. Till now, it is unclear whether the imagination of facial expression has a positive effect on recovery. Also a negative effect by increasing the mismatch between imagination and missing sensory feedback is theoretically possible. In the second phase, the motor recovery and reinnervation starts. In needle EMG, an increasing number of action potential is visible. The illustration on the right side shows facial muscle fibers visualized as hexagons, color-coded to show different muscles innervations by different axons of the same color. While normal innervation is illustrated on the left side of the face, on the right side only some nerve fibers are active. So an incomplete paresis with reduced motion is typical for this phase.
As soon as axons send a signal to a few muscle fibers, active movements can be practiced. It is important to keep the range of motion small because not all the fibers of a muscle are getting reinnervation at the same time. Powerful movements should be avoided to train precise facial movements. No symmetrical movements can be achieved by intense effort. On the contrary, the greater the effort, the worse the asymmetry of the face. It is important to practice movements that are as symmetrical as possible, even in the case of an unbalanced nerve supply as shown in the picture. At the beginning, when only a few muscle hexagons are active, feedback from a mirror can be helpful. In the next step, a comparison of muscle tension and skin displacement of both sides of the face can refine the sensory motor loop and help to recalibrate this loop.
In the third phase, when more and more axons regenerate and find their way back to the facial muscles, misdirected reinnervation will become a typical symptom. In needle EMG, pathologic co-activation of muscles can be proven, as shown in the two-channel EMG recording. During a smile, not only the zygomaticus muscle, but also the orbicularis oculi muscle is active. Even when the innervation of the muscle becomes better, we often see reduced facial movements due to the autoparetic symptom.
In this third phase, patients often complain of muscle shortening, high resting tone and pain. That can be reduced by an early start of neuromuscular training. If attention has already been paid to the feedback loop in the previous phases, it is much easier to reduce synkinesis. The patient must work constantly with her or his sensory feedback to control movement without synkinetic muscles stepping in. The sensory feedback loop is needed to monitor different muscle groups of one half of the face, but also to integrate the two sides of the face. Reduction of synkinesis is only possible with independent and high-frequency exercise. Mirrors, fingers on the synkinetic muscle, or surface EMG can be helpful to reduce synkinetic muscles. However, a functioning sensory motor loop is important to move the face in the best possible way without help of any devices.
I hope our three-phase therapy model based on EMG findings was interesting for you. We would like to discuss it with you right now or via email.
Thank you very much for your attention.